Me Medicine Cram Acyanotic Heart Disease, Flashcard Set 22, Congenital Heart Disease, Plan of Care. All right, before we get into the swing of things, let's just cover a little bit of background. Acyanotic heart disease is a group of heart conditions where oxygenated blood mixes with deoxygenated blood within the heart, okay? And of course, this can lead to, presentations like cyanosis, hypoxia, and hypoxemia, where hypoxia is low concentration of oxygen in the tissue, and hypoxemia is specifically a low concentration of oxygen in the blood. Now, congenital heart disease is an abnormal heart structure that you're born with. The you're born with part is indicated by congenital. Okay, and what's important to note is although someone can be born with a congenital heart abnormality, as they grow and develop, their heart can grow and develop, so it's generally considered a childhood condition, all right? Or it can be treated surgically. Okay, let's get into it. The healthcare provider is caring for a child with congenital heart disease. When planning care, monitoring for which of the following complications will be included in the plan of care. Is it A, congestive heart failure and hypoxemia? All right, so congestive heart failure is basically a weakness of the heart that leads to buildup of fluid in the lungs and surrounding body tissues. Because as you can see here in a normal heart, the muscular walls are a little bit thinner. They're elastic and pliable and responsive to electric stimulation. Whereas here, there's a buildup. So it's going to be difficult for the ventricles to contract, okay? And this is what leads to a buildup of fluid in both the lungs and other body tissues, right? Because the heart isn't contracting sufficiently, so there isn't sufficient circulation of blood. And hypoxemia, I think I mentioned earlier, is an abnormally low concentration of oxygen in the blood. Or is it B, bradycardia and hepatomegaly? Bradycardia, if you forgot, is an abnormally slow heart action, and then hepatomegaly is like an enlarged liver. Okay. Or is it C, increased pulmonary compliance and cyanosis, where pulmonary compliance denotes a measure of the lung's ability to stretch and expand, and cyanosis is a bluish discoloration of the skin, okay, it's blue, from poor circulation or inadequate oxygen of the blood, which would definitely result from a congenital heart disease. Or would the plan of care include pulmonary hypotension and cyanosis? Usually I hear pulmonary hypertension, where the arterioles in the lungs, they become very tiny and inadequate oxygen gets to the lungs. So I'm just guessing that pulmonary hypotension is where the arterioles in the lungs maybe become slack and expanded, or that not enough blood is being delivered to the lungs because of a low pressure from the heart. And cyanosis, we just previously covered, is that bluish discoloration of the skin due to inadequate oxygen. Okay, I know I said a lot, but I'll just give you a moment to think through each possible inclusions for the plan of care. So select the correct choice, okay? All right. Okay, so congenital heart defects definitely alter circulation between the heart and the lungs. So of the choices we mentioned, that would mean that D is a possibility as well as A, okay? And even B. so it's not really narrowing anything down. Specifically, though, congenital heart defects affect the heart's ability to pump efficiently. So still, we're left with these choices. But patients with congenital heart disease are generally at risk for developing congestive heart failure and then a subsequent hypoxemia. I think I gave away the answer prematurely by saying congestive heart defects, congestive heart disease instead of congenital. Well, at any rate, the correct answer is selection A, congestive heart failure and hypoxemia. These complications would definitely be included in the plan of care for a patient who suffers from congenital heart malformations. Okay? All right.